Be one of the three. It will be a different one that you can diagram and label for extra credit. All right. So the structures that we look at are made through these particular levels. And so your top diagram here is a coronal section through the brain at the level of the third ventricle. So we're seeing third ventricle and thalamus on each side. Now, if we're looking at a sensory pathway, it's going to be the post-central gyrus up here. And if we're looking and kind of tilted a little bit more like this, so we can actually grab the post-central gyrus. And if we're looking at a motor pathway, this is going to be the gray matter of the precentral gyrus. Okay? This next section right here, if you recall from the quiz, is the midbrain. And associated with it, the pons and cerebellum. So to get them to all fit on the page, I kind of overlap them a little bit. Then we have the medulla with the pyramids, and finally a cross-section through the spinal cord. So it's this lower cross-section through the spinal cord that I put back up here for those of you that might have a hard time seeing the bottom part of the screen. We can start off with that. So when we talk about a sensory or a motor pathway, we've talked several times about the upper and lower motor neurons. Those will not be new terms. I've talked about first and second order and third order neurons. Those are always sensory. So when you're diagramming the extra credit one, please don't label it, if it's a motor neuron, please don't call it the first order neuron. First order is always sensory. Obviously, upper motor is going to be upper motor. Nobody typically calls a sensory pathway an upper or lower motor. And so we're going to follow, for sensory pathway, we'll follow the sensory, the first order neuron, into the spinal cord. If it's going to cross at the level of the spinal cord, we'll take the second order neuron up through the various components of the brain stem. It will stop in the thalamus. And our third order neuron will go to the post-central gyrus. None of that was a new word that you hadn't heard before. Okay, you may not know it yet. I didn't promise you would understand everything I said today, but you will have at least heard it before. There's two new phrases, red nucleus and medial lemniscus. I haven't said before, except that I would have said I hadn't said it before. So spinal cord, let's just review some of these structures before we actually start the pathways. So for the spinal cord, I have the section at the cervical spinal cord, but it could be any level. All right, if it's lower limbs, obviously it's going to be lumbar or sacral spinal cord. So what structures forms this component right here? First of all, what is it? Remember? Dorsal root ganglion. So why is it swollen? Cell bodies of?
Pseudo-unipolar.
Pseudo-unipolar. Okay. What structure is going to have the cell bodies of multipolar?
Motor neurons?
The anterior or lateral gray horn. Okay. And bipolar neurons, remember from yesterday's discussion of the cranial nerves? So the olfactory passing through the cribriform plate, or in the retina of the eye is where we find the bipolar neurons. Okay. So looking at our diagram again, we have our, this isn't showing rami, but we would have our sensory neuron coming in through either the dorsal or ventral rami to the spinal nerve. Cell bodies of pseudo-unipolar neurons then pass through the dorsal root. Many of them will end in the posterior gray horn. The first pathway we're going to cover, they don't, but many of them do. And as we just discussed, the multipolar neuron cell bodies form the anterior gray horn, and they pass out to the ventral root. Right? So this is why I wanted to cover spinal cord the other day. This is where we're going to be using it. Then we get, from the spinal cord, we get to the medulla. So this was the diagram we saw in the quiz. So here's the medulla. And when we talked about the medulla yesterday, I mentioned the motor components. All right, and I also mentioned the nuclei. Remember what these were called? Gracilis and cuneatus. Okay, so then the most medial one is gracilis. From the lower extremity, we actually have a muscle in the medial thigh called the gracilis muscle. That's how I remember which is which. But we haven't done muscles yet, so that doesn't help you guys a whole lot. But medial is lower extremity gracilis and lateral is cuneatus. So would they be sensory, motor? And if they're sensory, which order? And where do they come from? So which of these apply? Sensory or motor? Sensory. And second order. Because this is, and if you're, we're going to look at this, if you're not sure why, this is most of our second order neurons form the posterior gray horn. But the nucleus gracilis and cuneatus is formed of the second order neurons for a particular pathway. And gracilis comes from the lower extremity, so it would only be sensory and D, second order. So here's nucleus gracilis, and right next to it is nucleus cuneatus, medullary pyramids. So if this was part of a pathway, and I diagram the pathway for you, I might say, name this structure. And so there'll be a list of a bunch of structures to choose from, or if I say name this, so that's what I'm looking for. Okay. Then our information, if we're sensory, is going to go up to our next structure, which is the pons. And so here's pons, in the back is cerebellum, because the cerebellum forms part of the pons. This actually goes back here as well. So we really don't, except for the cerebellar peduncles and the pontine nuclei, we're not going to have any other structure that stops in the pons. Then we get to the midbrain. So here is, for those of you that were hearing crus cerebri, this region is the crus cerebri. The entire structure is cerebral peduncle, so those terms can be interchangeable. Usually when we're talking about cerebral peduncle, we're talking about the crus cerebri of that. Substantia nigra. Here's the second new term. Red nucleus. Medial lemniscus is the other one. Cerebral aqueduct. All right, and then when we look at the cerebral hemisphere, I think most of you are comfortable with coronal section of the cerebral hemisphere. Again, if we're talking about a sensory pathway, it will be post-central gyrus. If we're talking about a motor pathway, we're going to be looking at pre-central gyrus. Okay? All right, so let's start off with our first, well, before we do that, on page 109, I've relisted the 3 different types of modalities that we looked at yesterday with cranial nerves. Pain, touch, and temperature, general somatic afferent from the body wall, from the skin and muscles, general visceral afferent, it's pain coming from an organ, and our special senses. And we, as I said before, we typically have a 3-neuron pathway. Smell is only 2. And we have a reflex pathway here that's only 2 as well that we'll show you. But first order neurons for our spinal cord pathway always have their cell body in the dorsal root ganglion. Okay? So this is some rules I've listed on page 109. So our first order neuron always has its cell body in the dorsal root ganglion. If we're talking about a cranial nerve, we don't have dorsal root ganglion. But remember, the trigeminal nerve had the semilunar ganglion. And the facial nerve had the geniculate. So any sensory neuron is going to be out, any sensory ganglia is going to be outside of the central nervous system. All right, second order neurons always cross over. The exception, and always you can say true to that. We do have an exception, and that's half of our second order neurons in our optic nerve pathway didn't cross over. Remember the pathway I drew for you? But I'm not going to have you redraw that pathway or do that pathway until our next unit when we look at the eye. But kind of in the back of your mind, yeah, it does. Some of those don't cross over. But for our rules, second order neurons cross. And where do they end up? The second order. Nope, they go all the way up and they go to the brain, and where do they stop? The thalamus. So the thalamus, remember, is formed by the cell bodies of the third order neurons. So the second order stop, and the region of the thalamus is gray matter. Most of it anyways, because those are the cell bodies of the third order neurons. And then from there, they're going to go, if it came from the arm, they'll go to one part of the postictal gyrus. If it came from the knee, they'll go to a different part. Now this diagram, I'm going to make it dark here for a bit. Sorry guys, in the back. This shows a little bit more three-dimensionally the diagrams that I have that we're going to be tracing through. So it looks more like a horizontal cross-section. And so for the posterior column pathway, our first order neurons come in, go up to the medulla, and then from the nucleus cuneatus or gracilis, they form this ribbon of neurons, the second order neurons going up to the thalamus. And only for the posterior column pathway, this is called the medial lemniscus. Right? So red nucleus and medial lemniscus are our two new words for today. So let's see how we create that. The posterior column pathway is a sensory pathway. You can tell from its name it's sensory because posterior. So dorsal structures, posterior structures are posterior. Its function is for discriminative touch. In other words, I can tell whether I'm touching a piece of plastic or a piece of paper. All right, I can tell whether I'm touching my jeans or my sweater. I can't tell what color my sweater is by my touch. So it's not that discriminative. But through feel, I can discriminate. I can tell whether the pain is coming from a fire or from, a knife. And so that's discriminative touch. Proprioception, we're getting used to that term. That's position sense. So I can tell whether my joints are flexed or extended, where my tongue is, if I stick it in or move it over to one side of my mouth. And vibrational sense, it's vibration, telling whether something's vibrating or not. Okay? So that kind of information is carried in the posterior or dorsal white column. To illustrate, I think I told you guys about the doctor who had a patient, a guy who had an associative disorder, and he thought somebody's head, his wife's head, was his hat. He saw another patient who, she got into the hospital to have her uterus out, a hysterectomy. And this was, back in the 80s where you would actually go in the night before your surgery instead of getting up at 4 o'clock and driving in to save the insurance companies a night's stay. She woke up in a panic and pushed the panic button, called her nurse, and she said, I don't know where my arm is. And the nurse could clearly see that she had both of her arms attached and told her so. And she said, but I can't feel it. And as the day progressed, she lost her other arm and both of her lower limbs. And they thought, well, she's just having an attack of hysteria because of worry and panic about getting her uterus out and what that means for herself and her marriage and everything. And so eventually they called in a neurologist. And through some further tests, it took another 4 or 5 days, they found out that she had a viral infection that had killed off all the cells, the neurons in the dorsal root ganglion, but only for the dorsal column pathway. So central nervous system, they didn't grow back, even though they're first order, they were in the posterior white column. And she had to relearn how to walk by watching herself in a mirror because she didn't know where her limb was. She could feel the pressure on the bottom of her foot, but she didn't know if her knees were flexed or extended or what her hip was doing. And so even though she did learn to walk by watching herself in the mirror, it wasn't a very smooth walk, all right? And she said the only time she felt close to being whole or alive was in a convertible. She couldn't ride a motorcycle, obviously, but in a convertible with the air blowing against her because she would get a sense of pressure. And that's in a different pathway. So that has always illustrated to me really well what this pathway does. Why we pull all of those fibers out and why there's so many of them and we pull them away from our pain, touch, and temperature, I don't know. But that's where they travel. Okay? So let's take a look at that pathway. And our first order neuron is going to come in. Remember, the only time it's going to come in is position for whether our back is flexed or extended. So we're going to look more at let's do our, what do I do with this one? Upper or lower limb? Okay, upper limb. And so our sensory neuron, first order neuron, comes in the ventral ramus, say from the elbow, and its cell body is going to be in the dorsal root ganglion. That's what makes the dorsal root ganglion. And then it does not stop in the posterior gray horn. It goes up to the medulla. So it's not crossing over because it's still the first order neuron. So here it is in the dorsal root ganglion, then it goes up behind, as it goes through the pyramids, it's coming up from underneath and going through the, this is sensory, so it's going to be going through the dorsal part of the medulla. And it ends in the nucleus cuneatus. The nucleus, gracilis, and cuneatus are formed by the cell bodies of the second order neuron. And so we'll put that in. I'll look it through here. We'll put that in right here. So there's the cell body of the second order neuron. It's going to cross over in the medulla, because remember our second order neurons cross over. So it didn't cross over in the spinal cord because that's not where it started, but here's the second order neuron, and all those coming from the upper limb form the nucleus cuneatus, crosses over, and that's what the medial lemniscus is. This is sometimes known as the medial lemniscal pathway instead of the posterior column pathway. So the medial lemniscus is associated only with the posterior column pathway. We don't have one in our other pathway.
So you said it goes through the grass.
So it's going to cross over. It's coming up. This is tilted this way, and this is going straight up. So it's not going through that one. This is just because I had to draw by it. So it starts here. No, it doesn't necessarily go. It's crossing over. It kind of crosses over like that.
As it's going.
Okay. Yeah.
Question.
So it's coming off the screen, kind of thing. Yes.
Does it matter what nucleus, on what side does it go through?
Well, it's going to go to, it hasn't crossed over yet, so it's going to go to the nucleus on the same side that the first order neuron was from.
Oh, no, I'm talking about the first order. Does it matter if it's going to go, just because, can you
Yeah, it's in the thalamus.
Yeah.
Okay.
Only feet don't go.
Okay.
So it's on the same
So when
side.
it go,
If it's coming from the leg, it will go to that one.
Okay.
Since it's coming from the arm, it's going to this one.
Okay.
Okay? If it's coming from the other side of the body, then it would go over to this side. Okay? So it crosses over, travels up the other side, and again, if we look at the three-dimensional aspect, and you can, so this is the medial lemniscus, it's crossed over, and now it's traveling up, it kind of turns slightly a bit, and comes up like that. Okay. And then it meets the third order neuron. All third order neurons have their cell bodies forming the thalamus. So the third order neuron is always going to be in the thalamus, and it goes to whatever level of the post-central gyrus it's coming, what part of the body it's coming from. Okay. So if you were to see this diagram, if this is one of the three diagrams that I asked questions about on the lecture exam on Thursday, one question could be just name the pathway. And I would have all the pathways listed. All right. Another question could be, is this a sensory or a motor pathway? So how can you tell that this is a sensory pathway?
Posterior.
Its first cell body is in the dorsal root ganglion. It involves the thalamus. So there's several different, it doesn't end in a cell body, it ends in the axon terminal. All right, up here, if this was a motor neuron, we'd start with the cell body up here. But probably the easiest thing is the fact that we're going posterior. We're using the dorsal root and the dorsal root ganglion for our our first order neuron. Another question might be to identify this bundle of nerves, which would be our new word, the medial lemniscus. I might say identify this gray matter here. I might say identify this neuron. And I would have a choice of first, second, third order, upper motor, lower motor.
So the medial lemniscus is just
The bundle of second order
right there?
neurons, yeah,
Okay.
after they've crossed over.
Okay.
Can you show it just one more time?
So all of these right here,
Okay. All the way up.
all the way up.
Okay.
Okay, so we'd see medial lemniscus in the pons. We would see medial lemniscus in the midbrain. All of that is medial lemniscus. Yeah.
The medial lemniscus,
Yes.
start over in the corner.
Yeah.
So it's
We don't really call it that. It probably still is medial lemniscus as it's crossing over, but we don't really start naming it that in cross sections of the brainstem until it's already going up.
okay. So once it starts.
Yeah.
Nice.
Okay? So posterior column pathway.
And that's what you would want to answer if you asked what the pathway was, or your bowel pathway.
Or you could, I mean, that would be what I would have on multiple choice. Medial lemniscus is another name for it, the medial lemniscal pathway, but it's also known as this. All right, so notice we have the 3 neurons. The next pathway is the lateral spinal thalamic. There is an anterior spinal thalamic, but we're not going to deal with it, okay? The crossing over happens differently. It carries the same kind of information, but it's not as common. So the lateral spinal thalamic pathway, you can find pictures online where it's more three-dimensional. It's pain, touch, and temperature from either your body, skin, muscle, or organs. So our general sensations were pain, touch, temperature, and proprioception. Well, proprioception is taken care of by the posterior column pathway. This is pain, touch, and temperature. All right? So I get a paper cut on my finger. Someone steps on my foot. I get a broken toenail. I get tickled. Tickling is a little less understood, but that's where the pathway is going to go. First order neuron. Same thing, has its cell body in the dorsal root ganglion. Only this time it stops in the posterior gray horn. The posterior gray horn is formed of cell bodies of our second order neuron. Now, this is a semester-long neuroanatomy class. You would learn that it's not just anywhere in the posterior gray horn. If it's coming from the thumb, it would be in a certain location. If it's coming from the foot, it would be in a certain location. So we have very determined, distinct localizations of regions of the body where these neurons come in and where they go to. But we're not going to get that picky. So the second order neuron is going to start in the posterior gray horn. It actually forms the posterior gray horn. It is a second order neuron. So guess what it does? Crosses over first. Our second order neurons cross. So remember, it crosses in the anterior white commissure, and it goes up the lateral white column. So all of those neurons going up in the lateral white column form the lateral spinal thalamic tract. It's going to look just like the medial lemniscus does in the brainstem, only it starts lower down. But we don't call it medial meniscus or lateral lemniscus, we just call it the lateral spinal thalamic tract. The tract is a bundle of nerve fibers that all carry the same information.
So it's just passing through the brain stem, so to say, it doesn't like go through one of those specific.
No, it's coming up through it. So if I go back to this image here, it's just passing up through it.
Okay, so it's not going through like the last bit.
No. All right, so what do second order neurons do? They end in the thalamus. That's what our previous second order neuron did. That's what this second order neuron does. Okay? It ends in the thalamus. And synapses with the third order neuron, which forms the gray matter of the thalamus and goes to the postcentral gyrus. This one you can tell by the name. It's going from the spinal column to thalamus, so it's going up. In the ascending pathway, it's sensory. No, it's post as well. Yeah. Pre is motor. Yeah, so if it's sensory, if I say identify this structure right here, and one of your choices was your choices for pre and post, you would know it was sensory because we were in dorsal root ganglia and we used the thalamus. So then you would choose post, because post is parietal lobe,
Because it didn't
sensory
go through the,
processing.
let's see, the whole
I think
bundle.
it's crossed over before, I know.
If I was asking you to identify the pathway?
Okay. Should I ask her?
Yes, that's what the difference is.
Okay.
Yeah. Yes.
The distinction between the medial lemniscal and this one, is it because it crossed over before, or is it because it didn't go through one of the canals of
The
the?
major distinction is because the first order neuron goes all the way up to the medulla before it stops.
Okay, that one. It crosses over later.
So it crosses
Okay.
over, the second order neuron is in the medulla, that's where it crosses over. Here, our second order neuron is in the spinal cord,
Mhm.
and it crosses in the spinal cord.
Okay.
Okay?
Thank you.
Gonna be the medial lemniscus.
No, it's the spinal thalamic tract.
Oh, you chewed on
That's
it.
it.
We can do that.
Sorry, moved on.
Yeah.
The difference between the dotted and the solid line is.
The dotted is just trying, my attempt to show that it's coming up from beneath. So it's coming up,
Draw this one.
and normally it would be hidden,
Okay.
because we can't see it because it's underneath. Yeah, and now it's going through, and we see it until it goes underneath
I
that
drew
way.
it going this way.
So the dotted line is not actually in that part, that structure.
It's underneath it. So in other words, I mean, if you draw it,
Am I
you can
erasing
look at
it?
it like this.
Got it, okay.
So we just can't see it because it's coming from underneath and getting up and finding it's passing through that particular section.
Yeah, you're welcome.
Okay.
I've seen. Not a big deal. I mean, it's kind of, I'm kind of a big deal. I'll go a little wee bit.
Okay, so our last pathway, our last sensory, we have 3 sensory, okay? Our last sensory only has 2 neurons. Only has a first order and a second order. So what structure do you think we're missing? The thalamus. Excellent. That's what makes up our third order neuron, is made up by third order neurons. This pathway doesn't go to the thalamus. Since it doesn't go to the thalamus, what else does it not go to? We don't do that pathway. It doesn't go to the postcentral gyrus. Okay? So look at its name. Spinocerebellar. Where do you think it goes? The cerebellum. Okay? Our cerebellum is for balance and coordination. So that's what we see here because, let's see if I want to hear. Because it doesn't go to the cortex, this is going to be for unconscious.
It's not nice.
Unconscious balance. In other words, I'm not consciously thinking about the fact that I need to maintain my balance
Right now.
I am now, but I normally don't think about that when I'm doing tasks. It just happens.
Can you adapt that? Like, can you?
Yeah. As far as conscious or unconscious?
Yeah.
Yeah, your brain can ignore what is normally a conscious pathway, but it would be a different pathway. It's just adaptation just means your conscious cortex is ignoring it
Okay.
and not processing it. All right?
That'd be cool.
So remember when we talked about the function of the cerebellum, we said that from our joints and from our body sense, our body knows what we're doing. The conscious knowledge of that is going to be our posterior column pathway, right? That's what we said, proprioception. So I consciously know if I have my eyes closed and I'm trying to touch the back of my neck, that's a conscious proprioception of where my body parts are, all right? But if I'm not thinking about it and I'm just doing movements and not trying to focus on that, then I have incoming proprioception that's going to end up in my cerebellum. So my first order neuron, just like any other sensory pathway, is going to have its cell body in the dorsal root ganglion. It's going to stop in the posterior gray horn. It's going to meet up with my second order neuron, which will cross over to the opposite side, same as we have here. So just like the lateral spinal thalamic tract, the spinal cerebellar tract, second order neurons. But instead of going up to the thalamus, when it gets to the pons, it goes into the cerebellum, and guess what it forms as it's going to the cerebellum? The inferior cerebellar peduncle. Told you guys would have heard most of these words before. So that inferior cerebellar peduncle is the sensory information, some of that sensory information coming from your joints and body parts, instead of going up to your brain for conscious recognition of it, heads off to the cerebellum to help the cerebellum figure out where you are and what to do and how to change your movement. So you don't have to consciously go, all right, I want to pick up that black pen. Oh, my hand is headed off over, I better move it over here. Now it's too far. Oh, I better bring it back again. Whoops, I'm too high, I better go down. I don't have to keep thinking of all those steps, all right? So that information about where my body part is getting to the cerebellum via this second order neuron, and that's what forms our inferior cerebellar pedunculus.
Joyce.
Okay? Told you we'd be getting into the big picture here. So spinal cerebellar, again, you can tell it's a sensory pathway by its name, because we're going from spinal column to cerebellum. We're going up. That's always sensory. Okay? Now we're going to skip pain discussion here for, so we'll leave that till Tuesday. Pain. Do the main substance P and all of that. So that's on page 115, and we're going to move to our motor pathways. But before we do that, any questions on sensory? All right, so make sure you understand the rules.
The sensory always comes into the dorsal.
Sensory is always, it could be the dorsal ramus, but we don't really do much with the middle of our back, those 10 inches that go down the middle of our back. So hands and torso and lower extremities are always going to be ventral rami. Okay? So yes, our first order neuron is always going to come in primarily the ventral. It's always going to go dorsal. The first order neuron cell body is always going to be in the dorsal root ganglion for a spinal nerve. It's always going to go through the dorsal root. It will stop here unless it's the posterior column pathway. So in the two examples we have, it stops here. The second order neuron will always cross over, either in the spinal cord or in the medulla, but it always crosses over. If we have a third order neuron, it's always in the thalamus. Okay? Now, motor neurons are descending pathways. We don't have any muscle in our brain that is voluntarily controlled. The only smooth muscle is our blood supply, and we're not looking at autonomic smooth muscle cardiac control in this discussion. Reflexes, yes, but not smooth muscle or cardiac muscle. So we have 3 neurons for our sensory pathway. First order, second order, and third order. These are all sensory neurons. Okay? The motor pathway has 2. Upper motor neuron and lower motor neuron. The upper motor neuron comes from the precentral gyrus or from the brainstem, The lower motor neuron is going to be found in the cranial nerve nucleus, or in the cranial nerve, or in the spinal nerve. So our cranial nerves have motor neurons. Remember, voluntarily move our eyeballs, voluntarily stick our tongue out. So those lower motor neurons are going to be in the brainstem, the midbrain, the pons, or the medulla. If it's going to my extremities or to my trunk, they're going to be in the spinal cord. That's what forms our anterior gray horn, cell bodies of our lower motor neurons. Alrighty? And for conscious movement, when I decide I am going to move my eyeball, that decision starts in the precentral gyrus. Remember, postcentral gyrus is sensory. When I make a conscious decision, I'm in my frontal lobe. So when we're in the frontal lobe, this now becomes the precentral gyrus instead of the postcentral gyrus. Okay? So 2 of our motor pathways are considered to be voluntary pathways. All of them go to skeletal muscle. We do have some that are involuntary. 2 will be voluntary, 3 are involuntary. Remember yesterday I talked about superior colliculus? Now I'm consciously making a decision to follow my finger. Okay? If I do it unconsciously, I'm not using my cerebral cortex, am I? So in that case, the upper motor neuron is going to be in my brainstem. So it does it as a sensory reflex without conscious control. So that's kind of the background for these next pathways. We're going to finish all the motor pathways today, which means the only thing we have to talk about on Tuesday is the pain, which is probably appropriate the day before the exam. We have a couple of case studies, at least one. Anybody doing Pick's disease in here? Okay, so a couple of case studies. And then we'll have review time. There'll be some lab time review time, also some slides. We'll talk about sample type questions on what to expect. All right? So, before we get to motor, let's cut one of our sensory pathways here. So what pathway is this? Already told you it's sensory.
Lateral, spinothalamic.
Okay, if it was posterior column, I'd be using these nuclei here.
So,
And so it is lateral spinal thalamic pathway. What kind of information? What kind of sensations?
temperature,
Pain, touch, and temperature. Okay, so I have in my midbrain, let's say that I have an aneurysm of my posterior cerebral artery, or maybe my basilar artery, and I've lost function of that part of the midbrain, and so this pathway, this spinal thalamic pathway is no longer working. All the neurons in it are dead. So I'm going to lose pain, touch, and temperature for half of my body. That side of my body, so it's the left side here that's cut, will I lose that pain, touch, and temperature from the left side of my body or from the right side of my body?
right.
Right side. So what it's opposite where my lesion is. We use the term contralateral. Contra meaning opposite, lateral meaning side. Okay? So the opposite side of the loss of function, we have to follow this back. This is where we lose the function because that's where the information came from. That's what we're not processing. Now if it was posterior column, or we cut the spinal nerve here and it's on the same side as the lesion, then we use the term ipsilateral. Okay? So ipsilateral, did I just add a new word or have I talked about this before?
We had ipsilateral before when we were
Okay.
Oh,
talking
you had
about the body.
unilateral before.
No, we had ipsilateral. It was one of those that we only used for a second
Just for-
at the beginning of the semester. I remember that because I
Okay.
got a bad.
At least I didn't lie about how many new words there would be.
Yeah, we used it.
Yeah.
All right. Yes.
So even if it crosses over, the second degree crosses over, it
If the damage is after it'll be on the same side, we're talking about sensory.
Get it, and
Okay, you just have to trace it back to where the information is coming from.
Even if it's on the second degree.
Right, if it's a second order neuron and the nucleus, they have to go together.
visual kinesthetic learner.
Okay.
Like colors and
All right, so cortical bulbar, you don't have a pathway in your lecture notes labeled cortical bulbar. This is actually just a variation of cortical spinal. Instead of cortical bulbar, you could think cortical brainstem. So this is a voluntary pathway for our cranial nerves. Cortical spinal pathway, and you can diagram this on the same one as page 119. Oops, not 119. 120.
so we're good with lateral cortical.
So what we're doing here is sending motor neurons to our cranial nerve. So this is illustrating the trigeminal nerve. I have it labeled on this one. So these are kind of weird. The same neuron goes to both sides. Not the same neuron, but the same pathway goes to both sides. Except in the facial. I'm not going to get picky about that. But, so here's our upper motor neuron. Let's say trigeminal is for chewing, right? Mastication, the dog chewing the bone. So if I decide I want to close my jaw, that's a skeletal muscle. So I'm going to activate the upper motor neuron in my precentral gyrus. That's going to come down as a projection fiber to my pons. That's where I have my trigeminal motor nuclei. And another one would actually go over to the other side. Okay, and then on this side, it will come down here, and then another one will go over to this side. It's just kind of weird that way. I'm not going to test you on that part of it, but we do have a crossover of information. Then the lower motor neuron is going to be in the pons, or it might be in the midbrain, or it might be in the medulla. Depends on what cranial nerve we're talking about. So if I want to voluntarily move my eyeball, ocular motor and trochlear nuclei, abducens nuclei are in the midbrain. What if I'm going to stick out my tongue? Where's the nucleus for that one?
Fossil.
Cranial nerve 12 will be down in the medulla. Remember where we saw cranial nerve 12 coming out either side of the pyramids? So if I'm going to stick my tongue out, the upper motor neuron is going to come down to the inferior portion of the medulla before it crosses over, or if it doesn't cross over. If I'm going to smile, what nerve is smiling? Facial nerve. Facial is right at the intersection between the medulla and the pons. It actually, I threw in a picture here. See how some of these nuclei are really long? So it might be in both the pons and the medulla. Well, we're not going to get picky about that part. But cortical bulbar means that the cranial nerve, the lower motor neurons going into the cranial nerve. So, on the exam, if my diagram looks like this, and it's not showing my lower motor neuron is coming out of the brainstem, you would recognize it as a cortical bulbar tract. How would you know it was motor?
It's coming from the precortex.
Because I have a cell body up here, all right? It's not going through the thalamus. And my cell, primarily because my cell body is in the cortex. It's the beginning of my pathway. It's a descending pathway. And you know that because my cell body is here instead of my neuron ending up there. So that tells you it's motor. How do you know it's cortical bulbar?
It's leaving.
Because it's leaving part of the brainstem, either the midbrain or the pons or the medulla. That's what it means is a cranial nerve pathway. That's what cortical bulbar means. Okay? So our cranial nerves are formed of the lower motor neurons. Everything else is very similar to cortical spinal. Any questions on cortical bulbar?
I have a question.
Yeah,
What's the difference between cortical spinal? Did you say something?
we're going to do that next. Cortical spinal means the lower motor neuron goes down to the spinal cord. Okay? So in our next diagram, this is cortical spinal. Notice the name starts out with cortex, ends with spinal. So you know it's a descending pathway, just by its name. Then when you look at the picture, there's the still body again at the top of the pathway. This is voluntary motor. This is, I'm going to consciously flex my arm, extend my elbow, scratch my head. That's a conscious decision. So when I make that conscious decision, an upper motor neuron in my precentral gyrus fires. The upper motor neuron sends a projection fiber down between the thalamus and my basal nuclei, down through, guess where it's going? Cerebral peduncles. In my cortical bulbar pathway, it goes through the cerebral peduncles